Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We are continuing to talk about the COVID-19 pandemic, the way it's affecting us in Guyana, the way it's bothering and affecting the rest of the world. Remember, if you have any questions or comments regarding the COVID-19 pandemic, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I advise you to wear your mask correctly at all times to cover both your nose and your mouth, and when you're taking it off, use the straps around your ears or the back of the head. I will take mine off because there's no one close to me to put me at risk, and I'm therefore not putting anyone else at risk. In addition, I have been fully vaccinated, and that means a couple of things. To be fully vaccinated has two main implications. One, I am less likely to transmit the virus from myself to people around me. And if I am exposed as a fully vaccinated person, I may become COVID positive, but I will not end up in the ICU, nor will I be on a ventilator. And all of the vaccines have the same effect. No person who has been fully vaccinated with any of the vaccines that are available, and in Guyana we have three main types: the Sputnik, the AstraZeneca, and the Sinopharm. No one across the world who has had adequate vaccination with these vaccines have been admitted to ICU, put on a ventilator, or dying, because all of the vaccines have been 100% effective in preventing severe COVID. And I can tell you, in our own experience at the COVID hospital in Liliendal, we have not had any fully vaccinated person dying from COVID-19. And that's our local experience, which is the same as the international experience. No fully vaccinated COVID patient has died since we started our vaccination program. In fact, even a single dose of the vaccine given more than 2 weeks has seen not a single one of those persons admitted to the ICU or dying. So even one dose, in our experience, we have not had anybody who had a single dose for more than 2 weeks admitted to the ICU or dying, not put on a ventilator, not developing severe COVID. If that doesn't tell you the story, then I believe there is not a lot more that we can say to convince you. People who are vaccinated across the world have had a better chance, even when they do get COVID. They do not end up in ICU, they do not end up on a ventilator, and they do not end up dying. So that's the message. That is the evidence and the push for us to all get vaccinated. Everyone who is eligible for vaccines should get vaccinated as soon as vaccines are available in their communities. We are now at the beginning of June 2021. The number of cases continue to rise in Guyana, not just Guyana, but in our neighbors as well and across the world. Across the world, we have had about 170 million persons getting COVID-19, and unfortunately, over 3.5 million persons have died. That's 170 million positive, and over 3.5 million people worldwide have died from this pandemic. In Guyana, we have had over 375 persons dying, and in our neighbors in Trinidad and Tobago, we have almost 500 persons dying. The vast majority of these deaths occurring in the last 2 months. That's in April and May of 2021. So we're definitely in a second wave or a spike as regards COVID-19 deaths in this part of the world. And what we have seen is that countries that have put in place aggressive vaccination drives, they have seen a significant decrease in their reported cases of positive COVID-19, as well as hospitalization and death rates. In some parts of the UK, for example, where there was an aggressive vaccination drive with the AstraZeneca vaccine, they have now just started reporting 0 new cases per day. And that's very encouraging. And in the US, there has been a dramatic decrease in the number of positive cases, in the number of deaths that have been recorded. You can recall at the height of the waves in the US, there were freezer trucks in front of hospitals that were collecting dead bodies for storage because the morgues had been overrun. And once they had put in place an aggressive vaccination drive, this has changed dramatically. We see across the world, in India, we continue to have daily devastating news of hundreds of thousands of people testing positive and thousands of people dying daily. And this is unfortunate and this is quite sad. But with vaccination programs and persons recovering from the natural infection, we assume and we expect that the rates at some point in the near future will start coming down. Remember, there are 2 ways in which you can develop immunity. One is by getting COVID-19 disease and recovering, and the second way is to get vaccinated. As a general rule, we prefer to get immunity through vaccination, not through getting the actual disease, because the disease itself is not just a one-off temporary illness in a lot of cases, but it can be something that persists with several lingering effects that we do not yet know all of the effects. We don't know if there are long-term effects on the heart, the kidneys, the blood vessels, the brain, etc. And so that is something we don't want to find out the hard way. We actually want to give ourselves immunity in a much safer, more controlled manner, which is to take the vaccines. Guyana is fortunate in so much that we have a good supply of vaccines that were procured. We have several persons, almost 200,000 persons who would have had at least 1 dose of a particular vaccine, a mixture of AstraZeneca, Sinopharm, or the Sputnik, and over 60,000 persons who would have had 2 doses and are therefore considered to be completely or fully vaccinated as of this point. So we are very fortunate. We are on top of the group in CARICOM in terms of the vaccination number, and we are ahead, quite in the lead actually, among Latin American countries. So we're very fortunate that we have had success in our vaccination procurement as well as our delivery to the population. I've always been very effusive in my praise and admiration for our public health teams across the country, and they have done a wonderful and remarkable job so far in our vaccination efforts. In this country, we have had outside of the box thinking in vaccinating our population. We have had drive-through programs at the National Stadium. We have had teams going to food places like KFC, etc., to give people vaccines. We have had people and teams going to religious houses at the mandirs, the temples, the churches, etc., to give vaccines. And so all of those persons who have been involved in these efforts are to be recognized for their tremendous effort in doing great service to this country. If we are to come out of this pandemic looking good, it is because of the efforts of these people and the healthcare workers who are taking care of those who have been sick and admitted to hospital and needing care. We often forget that the healthcare team is more than doctors, more than nurses. It involves also the attendants who collect patients from emergency rooms and triage areas and take them to the wards. It includes ambulance drivers. It includes pharmacists, technicians who do x-rays, people who do ultrasounds, echocardiogram, the people who take blood samples and who run tests in the laboratory. These are all people who make up the team, the healthcare team. It's not just doctors, it's not just nurses, the pharmacists and everyone else who are involved in this. If we come out of this, it is because of the effort of the entire team. And not to forget administrators and those policymakers who put things in place so that the system can actually work. So I want to encourage each and every Guyanese to make an effort to get your vaccine. Of course, there are lots of questions that people have when it comes to vaccines, but the answers, the real answers, can be found easily. Of course, there's a lot of propaganda, a lot of false information that's available on social media and some sites and some media that appear to be legitimate. But one has to be very careful in the information that you get. And so far, almost everyone can be eligible for a vaccine. In Guyana, we have a policy of 18 years and over. We offer the vaccines to all of our residents and citizens. The only persons, again, the only persons who should be cautious and not take the vaccine are those who have a history of severe allergic reactions to vaccines or any known component of these COVID-19 vaccines. That's it. No other group of persons are exempt or should be exempted from taking the vaccines. Of course, it's still voluntary and you still have a choice. But the only group that medically or clinically should be cautious and not take the vaccines are those persons who have a history of severe allergic reactions. And when I talk about severe allergic reactions, I'm not talking about a couple bumps on the skin and some itching. I'm talking particularly about shortness of breath, difficulty breathing, having to go to the emergency room, requiring injections of adrenaline or admission to hospital, and the worst case scenario are persons who require being admitted to ICU and being put on ventilators, etc. Luckily and thankfully, this group of persons are less than 1% of the population. So it therefore means that the rest, or 99% of the adult population, would have no real medical reasons for not taking the COVID-19 vaccine. It is still a choice, but people can examine the information, and most doctors you speak to, most healthcare professionals would advise you that you should take the vaccines. And that applies, and that is true for more than 99% of the adult population. So I want to encourage everyone again, unless you have a case of severe allergic reactions, to please go get your vaccines and give yourself the best chance whatsoever to fight this COVID-19 pandemic. Give yourself the best chance of staying out of hospital, staying out of the ICU, staying off of a ventilator, and staying alive. So I want to thank you once again for joining me on this program, Your Doctor in COVID. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thanks again for joining me.